Barbara White. Hey, Barbara White. I have Lyme disease. All right, so let me sell what you have naturopathically. Now, this is how the medical doctor says you have Lyme disease, which is incurable, basically, right? Anything's uncurable, and it's an autoimmune, right? That's allopathic concepts of Lyme, lupus, or fibromyalgia, basically, all right? Now, let's pull back on that, and let's say for a minute that allopathy does not exist anymore on this planet. The medical community does not exist anymore. Except for surgeries and emergency rooms, no medical doctor exists anymore. The concept of diseases are gone. Now, what's your problem? Okay, so what's some of the symptoms? Systemic pain, right? Now, what side of chemistry does the pain come on? Oh, a pain, acid. All right, now, where are these acids coming from in my body? Well, my body's made of basically just cells and two fluids. Now, my eating. Oh, okay, yeah. I am bringing in chemistry in my body, and I'm bringing in both acid chemistry and base or alkaline chemistry, all right? Now, the foods that are designed for my body as a human are fruits, berries, and melons. Oh, I've been eating dead animals, I've been eating grains, I've been eating beans, I've been eating acid-forming foods. So the bottom line is that your body's designed to eat foods that are base or alkaline dominant. Those are only a few out there. That's your fruits, your berries, your melons, and your vegetables. Now, most people have been eating acids, so if you're suffering from pain and acidosis and you're eating predominantly acid-forming food, is there a problem with that thinking? There's a huge problem with that thinking because you're just exacerbating your problem. You're eating acids and you're suffering from acidosis. They don't mix. You can't eat more acid-forming foods. What's acid-forming foods? Dead animals, grains, beans, dairy products, cooked dairy products in particular, cheeses, yogurts, you name it, pastas. You know, when you start processing, you get into acid dominance in your chemistry in the foods. You create coagulation. You create foods that all the chemistry starts bonding. When you cook, you bond. Remember, acids create a cationic environment. When you cook, you create a cationic environment. You start bonding the chemistry. So you destroy water solubles and you bond proteins to lipids and the like. So now you have a whole different chemistry than God intended your body to eat. Totally different. With a predominance on the acid side. Think of your car. Fuel in, acids out. Alkaline fuel in, this is just what gasoline is. Alkaline fuel in, acids out the exhaust system. Alkaline fuel in, fruits, berries, melons in, excuse me, peeing out and sweating out acids. That's our exhaust system, is our skin and our kidneys. That's our exhaust system. Our colon is more the elimination of unused digestive matter. But your urine and your sweating is actually metabolitic waste. And all that implies, also a little parasitic waste probably, and etc., etc. Now these are acids. Now ask yourself this. What if I took your car and I closed off the exhaust system, which is where all your acids are going to be leaving out of your motor, and I block that off? You mechanics out there know dang well what's going to happen. You're going to lose your motor. You don't block off your exhaust system. You open it up. So when you're sitting there with lupus, Lyme's, fibromyalgia, arthritis, what's going on here? Your intake has finally got you. Your intake of acids has finally broken down your kidneys, acidified your bowels and everything else. So now your body has broken down from all the ingestion of acid-forming foods, and you now have created a glomulation in your body. Your kidneys can no longer filter properly. Kidneys are being broken down everywhere. Tons of people are on dialysis because of that. People can't sweat anymore because of all the congestion in the head and the thyroid shutting down the body's temperatures. So now all these metabolitic waste from 50 to 100 trillion cells that comprise the human body are no longer able to leave the body. So when you lose the ability to filter or sweat, everything starts staying home. Oh, I like home better. So the problem with that, of course, is stagnation as the body builds acids up. You don't know it much. You get a little swelling here or there. You don't feel it much. The body gets a little stiff and tighter, and you get up in the morning, things have to stretch a little bit more and stiffer and tighter. Time goes on, you start getting a little this pain in the joints here and there, and goes on a little more, and your knees don't bend as well, and you're stiff, you can't bend down as much, and then your shoulders get stiff. Oh, my neck is stiff and tight, and then then pretty soon the pain starts coming more and more and more and more and more and more and more. Your joints start swelling up, it starts breaking down. Hips. So this is becoming majorly systemic acidosis. Forget this concept of diseases. This will only keep you away from the truth. This will only lock you in misery and pain, and you're trying to treat that. You're trying to treat stagnation of a major sewer system that's 80% of interstitial fluid in the human body. You're trying to treat that. That's the problem. You can't treat that with goodies of vitamin C, amino acids. That's even worse. You can't treat it at all. And that's why very, very few healers on this planet are successful at taking you from Hellville to Wellville. You must learn the truth and take yourself. We'll be glad to walk with you. But you have to learn the truth yourself, and you haven't been told the truth. So next time you're suffering and you go to eat proteins, rethink that. Because eating protein in pain will just make pain worse. Chemotherapy on pain? Whoa. So these are some of the things you have to think about. So if you have lupus or Lyme's, you have systemic acidosis. You have to get the kidneys filtering, get your body sweating. You've got hydration to do. You've got a lot of work ahead of you. This is reality. And you've had generations to break down your bodies. So now you have to spend a little time rebuilding it. Not generations, but certainly can take you a couple of years to get the body where you want it to be. So what? Have fun doing it. You feel better. You feel good. There's a little process to get out of pain, of course. It's called hydration and getting the kidneys to filter again. But once that happens, the pain starts getting less and less and less as you move these acids out. But if you treat this as some kind of disease and you're going after the bacterium in the body and stuff like that, that is insanity that takes you nowhere. And the only time you realize that is when you go to a medical doctor and diagnose with this, and then after all the treatments you realize these guys don't have a clue. And Lyme's lupus is another big one. All the same kind of crap. Whether you're blaming virals, you're blaming bacterium. Look at Lyme, or Lyme is a good one. They blame bacteria and that they give you tons of antibiotics, and all it's done is make you antibiotic resistant, kill the bacteria in your body, so you no longer have help breaking down the. You want it for all you guys suffering with pain. You want as much bacteria in your body as you can get, because they break down acids. And when they break down acids, you're out of pain. Think about that. You've got to get your diet on fruits, berries, and melons. I would stay away from the acid fruits for a while till you get some of this pain out of you, and then go in that direction. But you've got to get your kidneys filtered. You've got to understand what I'm talking about when we're talking about filtration of the kidneys. So you really want to get with this and get yourself down the road, Barbara. So I would go 100% raw, at least for now. Fruits, berries, melons, and some salads. Start weaning yourself off the salads and head up to a grape fast or something and start pulling this pain out of you. Get some herbs for your kidneys like you're going right now, and make sure we call you back and help you.